And this afternoon, Dallas County health leaders and hospital officials address their ability to handle more cases. Erin Jones is live for us now with what she learned today. Erin, they had a lot to talk about.
They did, Ken, and one of the things that stood out today is that the county is working to increase their testing capabilities. As of last week, they were able to test around 40 patients a day for coronavirus, but next week, because of a change to their testing procedures, they'll be able to test around 80. But the big increase in tests is expected to come from the commercial laboratories. They're working with the American Clinical Laboratory Association, and it says additional FDA-approved testing is available on large diagnostic platforms this week. The industry expects that its testing capacity will be at more than 20,000 tests a day. Then, if there are no delays or shortages by April 1st, that number should increase to around 280,000 tests per week. But today, health authorities stressed only certain people should be getting tested.
Testing is certainly not for people who have no symptoms that just, oh, I think I want to get tested for COVID-19, because again, there's still limited, samples. So it needs to be people who have symptoms. Then, there have been categories of people who've had either travel histories of places where there's known community spread or exposure to known cases who've been confirmed positive.
So at this time, those are really the people who should be getting tested. And we are told some of the most common symptoms for coronavirus are shortness of breath, a fever, and dry cough. Ken?
Erin, one of the things that a lot of people were asking about today, also top of mind, is the hospital's capability to handle sort of a high influx capacity should they need it. What at all did we learn about that here in North Texas?
Well, right now we learned that there are enough beds for these coronavirus patients, but one of the things that they touched on is that people just need to be practicing good hygiene, doing things like washing your hands, using hand sanitizer to keep those numbers low. That is really the top priority now. We also heard from Stephen Love. He's the president and CEO of DFW Hospital Council, and he tells us soon many hospitals may actually implement visitation restrictions and guidelines, and they'll be asked any visitors about their travel history. There will also be an age restriction on who can actually enter these hospitals, and the number of visitors is expected overall to just be curtailed in the near future. Another thing that was brought up that he was asked about specifically, do these hospitals have enough medical supplies to fight the coronavirus? In the news we've been seeing a shortage of masks being reported over and over, but he said right now everyone working in these hospitals treating these patients has enough supplies.